The subcommittee come to order. Good afternoon. Thank you to our witnesses for being here today to discuss a crucial issue before us, modernizing American healthcare, creating healthy options and better incentives. Chronic diseases such as cancer and cardiovascular disease are skyrocketing. 6 in 10 Americans have at least one of the two chronic diseases. According to Partnership to Fight Diseases, the projected total cost of chronic disease from 2016 to 2030, in terms of Florida anyway, was $3 trillion. These statistics are baffling and troubling, and I'm committed to helping lower the costs on some of these deadly diseases. This nation's chronic disease epidemic is out of control. I, for one, am excited that Mr. Kennedy has put this on an issue at the top of the administration in terms of his vision. I'm also very excited to say that this committee is spearheading hearings and markups that will be helpful to lead forward better health results and outcomes of Americans throughout this country. Congresswoman alone will represent McGovern, Evans, and Fitzpatrick into introducing legislation to establish a pilot program through Medicare to provide medically tailored meals to seniors. I was happy to see that this important initiative was introduced by American Medical Innovation and Investment Act that passed out of this committee. Since the last subcommittee hearing, I had the pleasure of meeting with numerous groups committed to fighting these issues, covering the majority of injured lives at 180 million lives. Employers are one group that can help make a difference in terms of the chronic diseases. In fact, 72% of employers saw reduced health costs after starting a wellness program in their own firms. Last week, Congressman Pinella and I introduced the Chronic Disease Flexibility Coverage Act. This important legislation allows for employers who offer high deductible plans coverage for their employees and the options of including pre-deductible coverage for services that treat chronic illness. At the end of the day, we can be empowered to take charge of our own health through key flexibilities, including a health savings account that can make a difference. We have another skyrocketing crisis on our hands, skyrocketing in terms of diabetics and obesity. Over 45% of our nation adults are obese, and in fact, 20% of the kids are. Joint Economic Committee led by Congressman Swiker is talking the obesity epidemic seriously. In fact, in a recent report, the committee found that obesity will result in up to $1.9 trillion in excess medical expenditures and cause the federal government to spend $4.1 trillion over the next 10 years. To bring awareness to these issues, Congresswoman Glenn Moore and myself have set up a caucus that are going to focus on this. I'd like to thank Congressman Moore for joining me in this critical effort and timing. Congressman Smucker also recently launched the MAHA caucus to focus on supporting Americans in living long and healthy lives through access to affordable high-care foods, which will make a difference. These are just some of the many things, great works we're doing is on a bipartisan basis on this committee. We are about to hear from a great group of folks that are on the front line in terms of employees and their customers. I look forward to working with all my colleagues at this Congress to tackle this epidemic.